force is working so well in every other thing, we just thought we'd do it for the healthcare system as well. So every hospital had to make its own, make up its own budget. And they got separated. There was no longer a network providing information back and forth. And some people have argued, that the rapid marketization of the Chinese healthcare system contributed in part to the slowness of the response to SARS. So market mechanisms are terribly important. They work in some instances extremely well, and we've got to figure out how to harness them for the sake of global health. In malaria, I worry, because the problem doesn't exist in the first world. Now, some people have said, well, but that's because, it's infectious disease problems that are mostly in developing countries. And you look at the annual heart attack deaths. Look at India, look at Africa, look at China. It's not as if poor people just suffer from infectious diseases. They also suffer from all these chronic conditions like heart disease, diabetes, and other problems. So we've got major problems. Healthcare for those countries is a major problem. And then if you look at health spending, Africa almost completely disappears except for South Africa. So a very, very low estimate is that at least 10 million people die every year from completely preventable, completely treatable things. Now, if you add into that all the children who die under the age of 5, some 15 million, kids shouldn't die under the age of 5. You've got a huge, huge problem to tackle. At Partners in Health, this is where we work. We started out just in Haiti, and then the second developing country we began working in was Roxbury in Boston, and then we spread from there. Because for us, it's always been the same. It's about the problem of delivering health care to the poorest. How do you do that? What can we do to make that a reality? This is Caraballo. It's in the northern cone of Lima, Peru. It's where I first went in 1994. And this is, among the developing countries we work in, this is actually the wealthiest. You can tell some things about Peru and how fast the economy is growing, because even though the houses don't look so great, you see lampposts. So that about 50% of the households had electricity when we arrived there. Now, this is not your sense of the suburb that you want to live in, but these straw homes turn into brick over time. And they know that that's going to happen, and so the government puts in this infrastructure knowing that over time these houses are going to evolve. So when we went to Peru in 1994, we discovered patients like this who were in what was at that time the best tuberculosis control program in the developing world. Peru had made stunning achievements in tuberculosis control, and yet we were finding patients like this who'd been treated once, twice, 3 times, 4 times in the standard TB control program, but who were still sick, who were still coughing, who still clearly had tuberculosis. We decided that we needed to find out what